Happy to present again here. So in this talk about pediatric bilateral cochlear implantation, I'd like to answer, are two always better than one? And to spoil the end result, I would say in terms of pediatric cochlear implantation, it does seem that two are almost always better than one. So again, I'll start with my three take-home points because I know that I have difficulty remembering too much from presentations. The first is that bilateral pediatric cochlear implantation improves auditory and language outcomes for children. The second is that a decreased inter-implant interval, and that describes the time between the first cochlear implant and the second cochlear implant, leads to better overall CI outcomes. Less than 12 months between cochlear implants is ideal, and simultaneous bilateral cochlear implantation is best for outcomes. And number three is that bilateral pediatric cochlear implantation is safe and cost effective. These are all points that I think many people have been thinking about for many years, but it's an exciting time because there's a lot of recent data that I'll show you some of tonight that drives these points home. So in an overview, I'll first talk about physiology, then I'll talk about outcomes, then that inter-implant interval, the effects of that on outcomes. Then I'll talk about the safety and cost, and then just a brief amount on surgical concerns. So the physiology of bilateral cochlear implantation. Just as a review, although all of you are very familiar with this, there are very clear benefits of binaural hearing from both ears. There's things like the head shadow effect, where the sound coming to one ear it allows you to attenuate as it passes through the head so that the other ear can hear better. There's the squelch effect, also known as the cocktail party effect, that when you have two listening ears, it allows you to better differentiate speech from noise. There's the summation effect, where there's a boost in loudness when sound is heard in both ears. And then there's the localization effect, which is your ability to localize sound in space. These are all clear benefits of having binaural hearing. We're learning more and more about the auditory physiology of bilateral cochlear implantation. Karen Gordon's group at University of Toronto has done a fantastic job describing some of the real-life auditory physiology. In this study, they looked at children with single-sided hearing loss, and you can see immediately after cochlear implantation, the auditory stimulation is all primarily on one side compared to stimulus to the hearing aid or normal hearing ear. After 10 months, the stimulation to that same cochlear implant ear evens out and resembles more the normal auditory physiology. What we're getting a better understanding of is that children in particular very quickly develop oral preference or preference for one ear. And our goal when treating patients should be restoration of normal auditory physiology. And in order to do this, we need to avoid oral preference or preference for one ear. The Karen Gordon's group at Toronto also showed some very beautiful data in 2012 looking at patients that had sequential implantation. So this is bilateral cochlear implantation that was not performed on the same day. And this is auditory brainstem responses with the right ear in red and the left ear in blue. And you can see that there is some dyssynchrony all the way to the brainstem with auditory stimulation between right and left. But when simultaneous implantation is performed, this dyssynchrony in the physiology of the auditory stimulus disappears. And so the idea is that simultaneous implantation leads to synchronous auditory physiology. And this really should be our goal. However, it's only been recently that we have very good data showing that this synchronous auditory physiology does improve cochlear implant outcomes. So next I'll talk about the cochlear implant outcomes. This was a really fantastic study done in the Netherlands by Boons in 2012. This was a well-controlled study with 25 very well-matched children that had 3 years of follow-up. And when you compare children that have unilateral cochlear implantation versus bilateral cochlear implantation, you can see that the overall language development was significantly better in bilateral cochlear implantation, as well as the word development and the sentence development were all significantly better in bilateral cochlear implantation. And importantly, these are children that were matched and had the same hearing loss in both ears. And so this is an effect just of bilateral cochlear implantation, which greatly improves expressive language development. More recently, just this year, this paper from Kevin Brown's group at University of North Carolina had 204 children that were matched, including 105 in the bilateral cochlear implant group and 99 in the unilateral cochlear implant group. In this study, they controlled for the age at first implant, the age at testing, and the socioeconomic status. And what they found is that children with bilateral cochlear implantation developed significantly better receptive language scores, or an auditory language score, as well as significantly better expressive language scores. And so it's clear from this data that bilateral cochlear implantation does lead to improved receptive and expressive language development. So what about the inter-implant interval? This is the time period between the first cochlear implant and the second cochlear implant. Going back to that paper from Gordon et al. In 2012, where I showed you the synchrony between sequential versus simultaneous implantation, what you see is that if you have a long delay between the first and the second cochlear implantation, as shown here, your physiology is more dysynchronous. So there's a larger difference between the two cochlear implant sides. Whereas if you have bilateral simultaneous cochlear implantation, the difference between the two sides is much shorter. So the longer the time period between sequential cochlear implants, the greater the asynchrony in the auditory response. And so you would think that that would lead to a difference in cochlear implant outcomes. And this is in fact true. So going back to the Boons paper in 2012, you can see very nicely that as you increase the interval from the first to the second cochlear implantation, there's significantly decreased overall language, expressive language scores, as well as word and sentence scores. Here you can see from a simultaneous cochlear implant up to 3 years sequential time period between cochlear implant number 1 and cochlear implant number 2. So as you increase the time to the second cochlear implant, you decrease the language outcomes. And this is what's very interesting, I think, about this study, is that you can see if you perform cochlear implantation in less than 12 months, or as close to 12 months as possible, it seems to work the best to improve language outcomes. So most of the decline in language outcomes seems to happen at about 18 months and on. And then this really nice study by Lowe et al. Again, this was Karen Gordon's group at University of Toronto and Blake Papson. They looked at the inter-implant interval and the number and the usage of the second cochlear implant. And this is a very important number because it tells you how often the child is actually using that second cochlear implant. So really it tells you how much you think, or they think, that it is helping them. So if the inter-implant interval is less than 5 years, then 91% of the children were using their second cochlear implant. If it was 5 to 7 years, then it was 80%. And if it was greater than or equal to 7 years in between cochlear implant number 1 and cochlear implant number 2, it was only 50% used their second cochlear implant. And so the longer the time period between sequential CI, the less likely they are to use their second cochlear implant. And so really, to summarize the implant interval, I would say that simultaneous bilateral CI is best for outcomes, and less than 12 months is ideal. So what about safety and cost? Clearly, this is a difficult topic to discuss because there are various different healthcare systems with different ways to pay for surgery and cochlear implants, and there's different training that surgeons are familiar with. There's been several very good studies looking at cochlear implants safety, including this consensus statement from the European Cochlear Implant Forum. And all of them show that there's no increased surgical risks for bilateral simultaneous cochlear implants. So this is surgical risks including injury to the facial nerve and infection. Several groups have also looked at operating time. So if you compare a unilateral cochlear implant, these surgeons in this study, they performed a unilateral cochlear implant in 3 hours. They performed a simultaneous bilateral cochlear implant in 4.62 hours. So this is less time than it would take to perform 2 unilateral cochlear implants. Similarly, with costs, a unilateral cochlear implant in this study was $4,300. A simultaneous cochlear implant was $5,000, and 2 unilateral, therefore, was $8,700. This obviously does not include the cost of the cochlear implant itself, which would be the same if you do simultaneous bilateral or unilateral. So based on this study and others, simultaneous bilateral cochlear implant decreases surgical time and decreases cost. There's been several other larger studies in adults and children showing that bilateral cochlear implant is cost effective in several different countries, including several different healthcare systems. So there's a very good study in Spain of 273 children, over 100 children in the United Kingdom, over 140 children in Canada, or adults in Canada. And all of these showed that bilateral cochlear implantation is cost effective. And importantly, all of these showed this whether it was simultaneous or whether it was a sequential bilateral cochlear implant. It's a huge benefit to the patient to have bilateral hearing. So what about surgical concerns that people have with bilateral simultaneous cochlear implants? Well, first of all, there was a theoretical concern about damage to the chorda tympani bilaterally. There's been no data supporting this as an issue, as all of us know that perform cochlear implant surgery or any other ear surgery, typically damage to the chorda tympani is a transient side effect that goes away with time, and it does not seem to be an issue if there's bilateral damage. There was some major concern about bilateral vestibular failure, and we do know that some children undergoing cochlear implantation will have issues with vestibular dysfunction or measurable changes to their vestibular function after cochlear implantation. But permanent bilateral vestibular dysfunction is exceedingly rare and really has not been reported outside of case reports in the literature. And so it does not seem to be an issue, particularly with children. I think it's really important for everyone to remember that not all planned bilateral cochlear implants that are simultaneous will result in a bilateral cochlear implant. So this nice study by Holland in 2012 showed that of 50 patients, the result came to be that only 39 children, even though these were planned to be simultaneous bilateral cochlear implants, only 39 or 78% had simultaneous bilateral cochlear implantation that same day. In 11 of these patients, the plan was changed to sequential implantation due to otitis media. In 2 out of 11, it was changed due to OR time constraints. In 1 out of 11, it was an unrelated cause. It was an injury to the other ear. And so I think anyone who's considering or counseling patients or families on bilateral simultaneous cochlear implantation should make sure to tell patients that we're going to try for bilateral simultaneous cochlear implantation, but there's a chance that we would only be able to implant one ear. And this is perfectly reasonable in my mind. So there are still many questions, but one big unanswered question for me that I receive very commonly from patients, especially in Boston and in the United States, when people are reading on the news about gene therapy, they say to me, "Doctor, I want my child to be able to use that new gene therapy that I've heard about. Can my daughter have gene therapy if she has bilateral cochlear implants?" And this is a really excellent question. I enjoy trying to answer this question with my patients. There's no right answer for it. But what I would say is that we need to weigh the risk of waiting for the child versus the possibility of a cure in the future. So I know that gene therapy for hearing loss is around the corner, over the horizon. We're going to be starting clinical trials in the US within the next couple of years. But the ability to have that applied to your specific patient, the chances are very, very slim. But it's very clear what the risks are of waiting to perform bilateral cochlear implantation. There's a risk of auditory dyssynchrony and oral preference between the hearing ear and the non-hearing ear. And there's a very real risk of worse cochlear implant outcomes. So take-home points, again, bilateral pediatric cochlear implantation, it does improve auditory and language outcomes for children, and it does seem to be better than unilateral cochlear implantation. And a decreased inter-implant interval leads to better outcomes. So less than 12 months between the first and second cochlear implant is ideal, and simultaneous bilateral cochlear implantation is best for outcomes. And finally, bilateral pediatric cochlear implantation is safe and cost-effective. So with that, I'd again like to thank you very much for having me. It's really my pleasure. This is another view of Boston. It's not as beautiful as Mexico City, from what I hear, but I hope that you all can come to Boston someday. Thank you.